Cannabis as Medicine, Canada for medical practitioners. What is medical cannabis? We all know what cannabis is, but what are the formulations? Oil, PO, capsules, PO, flower, inhaled, spray, sublingual. Physiology. The endocannabinoid system includes a group of receptors. The main receptors are CB1 receptor, primarily found in the CNS, but also in the reproductive tract, thyroid, digestive, lung, kidneys, and fat or muscle tissue. CB2 receptor, primarily found in lymphoid tissue, spleen, tonsils, thymus, white cells, and microglia, immune cells in the CNS. Endocannabinoids, primarily anandamide, partial agonist, and 2-AG or agonist. Exogenous cannabinoids. THC, the plant's primary cannabinoid. 1. CB1 and CB2 partial agonist. 2. Contains the main psychoactive component of cannabis. 3. Analgesic, antiemetic, anxiolytic, appetite stimulant. CBD, the plant's secondary cannabinoid. 1. CB1 and CB2 antagonist. 2. Contains little to no psychoactive qualities. 3. Anti-inflammatory, antispasmodic, anxiolytic. Physiological roles. Pain. Suppression of nociceptive transmission via activation of CB1. Learning or memory. Suppression of hippocampus due to high CB1, possible role in PTSD or anxiety due to suppression of fear memories. Appetite. CB1 activation in hypothalamus. Immune system. CB2 activation modulates the recruitment, migration, and apoptosis of immune cells. Indications. Health Canada lists the following as common but not limited to indications: chemotherapy-induced NV, refractory pediatric epilepsy, palliative care, pain, NV, appetite stimulant, neuropathic pain, spasticity from neurological conditions, anorexia from chronic illness. That's not all. Other conditions include depression or anxiety, endometriosis, IBS, PTSD, dementia, fibromyalgia. The list goes on. Side effects. The most common side effects include dizziness, sedation, somnolence, dysgeusia, attention disturbance, headache, memory impairment, balance disturbance, dry mouth. Contraindications: psychotic illness, children, pregnancy or lactation, hypersensitivity. Renal or hepatic disease. No studies have been completed yet. Undergoes hepatic metabolism and proportion is renally excreted. Possibility of exaggerated or prolonged response in people with SIG hepatic or renal impairment. But what about addiction? The probability of transition to dependence for the below substances are cannabis 8.9%, cocaine 20.9%, alcohol 22.7%, tobacco 67.5%, opioids 23%. Why is this exciting? A new class of drugs that acts on endogenous CNS receptors that is not dangerous. Onset and duration. Dosing. Titrate according to desired effect. Remember that there is very low toxicity from cannabis. How to access. Requires a medical document to be sent to a licensed producer and registration form to be completed by the patient. Can be confusing for those not familiar. Not difficult once you have done it a few times. No special license required. Any general practitioner or nurse practitioner may prescribe. Evidence? Hundreds of observational studies have been done over the years, and now some official clinic trials are underway. Avail is currently conducting ongoing research through a cutting-edge mobile app which collects patients' data to improve efficacy. Until now, conducting large-scale research has been time-consuming and expensive, but now can be completed right from the patient's home. So, give cannabis a go in patients that are refractory to traditional treatment. It's safe, not addictive, easy to access, not difficult to titrate or prescribe, causes little harm.